a man come today, a little wine by your coast. What a she? Old age no catch up with you, so come on, let me take a little jam while we young. Old age no catch up with you, so come on, let me take a little jam.
Welcome back to the Now Morning Show. 90 minutes past the hour of 6 o'clock. It's time for Spotlight, where we take a further deep dive, into menopause.
Inside your Spotlight this morning, we are talking menopause. And to do that, I welcome Dr. Samantha Bhagan Lalla, obstetrician and gynecologist. Good morning to you, Dr. Lalla.
Good morning to you, and good morning, listeners and viewers.
Thank you
And
very much for
enjoy the program today.
Thank you very much for joining us this morning. We're looking forward to this conversation because I know a lot of people want the information. Let me start from the place of most men, right? What exactly is menopause?
So menopause is when a woman has stopped seeing her menstrual period, usually for the last 12 months of her life. So that's when it starts. The cessation of menstruation for 12 months is considered menopause.
Okay.
Now, there are different...
Around what age does it start?
Okay, so the average age of menopause is between 51 to 52, but it can start between the ages of 45 to 55, 45 to 55.
And I understand that there's also something that happens before perimenopause.
Yes, so perimenopause is considered the cessation of your menstrual cycle when the ovary cease to function. So when the ovary cease to function, that is considered perimenopause. It usually starts before the age of 45, roughly from around 40 to 45. So at this stage, women stop seeing the ovary cease to function, so they get an irregular cycle and also some changes that occur with it.
So, all right, just to be clear, the perimenopause is when you start getting irregularities in your cycle, and then menopause is when your cycle completely stops, yeah?
Yes, when the cycle completely stops, or at least 12 months, then 12 months duration.
Now, I know that sometimes
menopause.
I know sometimes women can experience symptoms similar to that, so that they would have irregularities in their monthly cycle. How do you tell the difference between a regular irregularity versus when you start perimenopause?
Well, it all depends on the age of the person. So perimenopause is usually started after the age of 40, right? And women tend to have, when there's a stop, is when your ovary cease to function. So therefore, we start getting irregular cycles. Now, with some people younger people may have irregular cycles, and that usually occurs when there's a hormonal imbalance, such as polycystic ovarian syndrome. And to diagnose that, usually what we do is we take a history of their menstrual cycle. We also do a blood test to confirm if they have polycystic ovarian syndrome, and we do an ultrasound to look at the uterus and the ovaries to see if they're cysts in the ovaries. Now, perimenopause... Go ahead.
No, you go ahead. You go ahead. Tell me perimenopause.
Now, so perimenopause usually starts from the age between 40 to 45. And then some women who can experience premature menopause. That is menopause that occurs before 40. So usually we do a blood investigation to see if they're into premature menopause. And then after menopause, which is the cessation of the menstrual cycle for 12 months, then we go into postmenopause, which can occur for the rest of our lives.
All right, wait, before we get into the rest of the life, let me deal with the menopause part first. What are some of the symptoms that you can say you see, besides, of course, the stopping of the cycle for 12 months? What other symptoms are there involved with menopause?
Some of the symptoms women experience, like hot flushes, night sweats, they become irritable, there's loss of libido, dryness of the vagina. Usually I have urinary frequency or the urge to go to the bathroom often. Some people may have a little bit of depression with that and mood swings with it.
Do those symptoms also start with perimenopause, or do they only start when the menopause itself hits?
Sometimes the symptoms can start in perimenopause. So that's how women start to notice these changes, and they'll come to see their gynecologist. Mm-hmm. If they're going through like hot flushes, they feel very hot, heat intolerance, some irritability, loss in sex drive, the vagina is a little bit dry, then they see the gynecologist to check to see if they're into perimenopause.
Are there any risks associated with menopause?
As we age, as women age, there are risks involved in menopause. So with menopause, we have a risk of, because of the low estrogen, when the ovary cease to function, the hormones drop. So the estrogen drops, the progesterone drops, and the testosterone drops. So when the estrogen drops, there is an increased risk of osteoporosis. Estrogen is needed to carry calcium into the bone. So women who enter menopause are increased risk of osteoporosis. There's also an increased risk of cardiovascular abnormalities when we go into menopause. So those are the risks involved with menopause. But there is help available to women as we go through menopause.
All right, tell me about some of those ways that they can get help.
So usually when a woman comes to us and we investigate them, we can do a hormonal test to check what their levels are. We also investigate their risk factors before we give them some treatment. So if it is they are low risk, we can give them some hormonal replacement therapy. Now, hormonal replacement therapy, because of the decrease in estrogen and progesterone, we give women estrogen replacement. So women who are into menopause and they don't have a uterus, we usually give them estrogen treatment. It can come in the form of patches or tablet forms, or they even have sprays available. Now, women who have a uterus, we usually give them combined therapy. So you give them an estrogen and progesterone type treatment. So the estrogen in Trinidad, we have something called Angelique. It's a tablet. So it's a continuous form of the estrogen and progesterone. They are available, but not in Trinidad as yet. I'm hoping that it will come here soon. So we have patches and we also have the Americanized progesterone tablets you can give. For women who have decreased libido, there is a estrogen, testosterone that we can give them. It comes in a pump form, and that will help them with their sex drive. Also, we have for vaginal dryness, which is one of the things that women seem to go through into menopause. The tissue of the vagina becomes a little bit thin. It gets a little dry. There's decreased secretion. So there's topical vaginal estrogen creams that we can give to women to use for that. And that is presently available in Trinidad for that. There are vaginal estrogen tablets that we can give them, but that's not available as yet. I'm hoping that it will be available in Trinidad soon. So those are the things that we can give to women. Now, there was a recent study that was released, and it said that women in the menopausal range, we tend to, from recurrent urinary tract infections, going to the bathroom often, and they have found that topical estrogen cream can help women who are going through these symptoms. So now we are recommending topical estrogen cream for urinary tract symptoms in menopausal women.
All right, so that we can see that would help in those particular symptoms, but the hormone therapy, does it help with the other symptoms as well?
Yes, so the HRT does help with the hot flashes. So we're taking it orally or the patches or the tablets. It will help with the irritability, the hot flashes, the mood swings that women go through in menopause.
In terms of, I know that women often have to get pap smears, they have to get mammograms. After, when you get to that point of menopause, do you have to continue doing that?
Oh, yes, we do recommend that. So when a woman reaches the age of 40, usually the gynecologist will recommend the mammogram for them. Now, pap smears should be done at least one year after becoming sexually active. So women should do their pap smears every year, and they should get their mammograms done every year. So yes, in menopause, we would continue that. Usually after the age of 52, I usually recommend for my patients to do a colonoscopy, right, to look for the increased risk of colon cancer, and also to do a bone scan to assess the risk of osteopenia and osteoporosis. Because of the decreased estrogen in our bodies, we can become osteopenic and osteoporotic. So therefore, I would recommend doing a bone scan after the age of 50.
Doc, tell me about some of the cardiovascular things that could go wrong. You mentioned that earlier, that there could be cardiovascular symptoms. What are some of those?
Well, as we age, because of the decrease of estrogen in our body, we are increased risk of getting heart attacks and strokes. So usually if it is that you are low risk, we can recommend HRT for women because they are showing that it helps cardioprotective for women as we go through menopause. Now, usually the HRT is started. We usually started once you become menopause, we started. So usually I say started just before you become menopause, so therefore it decreases if you get any cardiovascular abnormalities. So usually we start it just after you become menopause, or when you enter perimenopause, we could start the HRT, and it shows to be very cardioprotective for our hearts.
Doc, in terms of preparing yourself to be able to go through this phase of life, is there any like lifestyle changes or anything like that that can help?
Lifestyle changes, I would recommend regular exercises for women, especially as we age now. We recommend strength training to help us with our bones. Eat healthy foods, which is very good. You can also eat foods that are good in estrogen. So, for example, like the soya, the flax seeds, we usually recommend that for women. We also recommend for them to take their calcium, right? Also, with the calcium, now we need the vitamin D with K2. That increases the calcium entry into the bone. So I usually recommend that for women. Also, another thing that we are looking now into menopausal women as we age is dementia. So dementia is a big thing now that they're doing, and they usually recommend for dementia, we take our probiotics. They're saying now we should take our magnesium and the vitamin B. That also will help with cognitive function, because as we age, all these things will happen with us as we go through these stages in our life.
And it sounds like quite a lot to go through. Tell me, how can we as men be able to support the women in our lives who may be going through menopause or maybe perimenopausal?
I think men should understand, because they also go through a decrease in testosterone as they age. And I think there should be understanding of the wife. And I have many couples like this, and I usually commend the husbands who come with them and are sitting with them and are going through their stages of life. So they're being there with them. They can understand, and they are patient with their wife. Once you understand all these things are going on, a woman, and you're patient and you can go through the feelings together, that is a good partner for a companion.
Are there any questions that women should be asking their doctors when they go to do the pap smears, the mammograms, when they go to do regular checkups, just to make sure that they're on the right path when it comes to being prepared for this phase of life?
Well, they should tell their doctor what symptoms they're having. If they're having symptoms, they should go through this and know there's help available. For mammograms, their doctor, the gynecologist, should recommend the mammograms after the age of 40. So that's something that should be done by all gynecologists. But once you go through the symptoms and knowing that there's help available, they should discuss it with their gynecologist, what symptoms they're having, and then they can be treated accordingly. So usually what we do is we take a medical history, assess their risk, and once they are safe, they can go on to hormonal replacement therapy. If they are considered high risk, there are also help available in herbal forms of estrogens. So that is also available to women.
Thank you very much for sharing that this morning, Doctor. Now, outside of the actual medical doctors, is there support, or should there be support, or should women be seeking support from people like mental health practitioners or mental health doctors to be able to support them as well during this phase of transition?
Yes, so depending on the patients, if it is that they having some depressive issues or anything like that, usually we can recommend, and there are groups available that you can go and you can sit down with some or counsel, like a psychiatrist or psychologist, and they can go through with them what is going on. And even the gynecologist, sometimes we take the time to listen to patients and go through the process with them and guide them accordingly. So always remember there is help available when we are going through this stage in our life.
All right, one more question before we wrap this morning, Doc. In terms of how menopause, does it affect your risk for other health conditions as you get older as well?
Well, menopause, as I said, basically the risk factors available is just the osteoporosis, cardiovascular, and now we're looking into mental health, which is dementia as we age, which is a normal thing. Mm-hmm. But as we age, as women, we have to worry about our risk of breast cancer. We have to watch for our risk of colon cancer. So that's why I recommend the colonoscopy for women. Also, your cardioprotective. Look at your heart. So see a cardiologist after the age of 50, assess your heart risk so they can check to make sure there's no abnormalities with your heart. So those are the major things we really will watch as we age.
Dr. Lalla, let me say thank you very, very much for joining us this morning and for sharing this information. I think it was very, very helpful to a lot of people. I see even the women in studio open their eyes at some point like, oh, wow, all right. So they know what they're in for. So thank you very much for shedding some light on it.
Available and And thank you for having me, and I hope I helped my viewers and the listeners there. Thank you so much.
Thank you so much, Dr. Lalla. Enjoy the rest of your day.
And
That's Dr. Samantha Bhagan Lalla, obstetrician and gynecologist, sharing with us some information as it pertains to menopause, perimenopause, and how you can be best prepared or how you can be best supported. We take a quick break and we come back with more on the Now Morning Show. Stay tuned.
Old age, no catch up with you, so come on, let me take a little jam while we young. Old